I'm Spencer Johnson, and I'm president of the Michigan Health and Hospital Association. At the MHA, we focus our efforts on how best to advocate for Michigan hospitals and the patients they serve. As you know, the healthcare environment is full of challenges, from obtaining needed hospital funding to maintaining adequate access to healthcare to promoting healthy lifestyles that prevent chronic disease. But perhaps the most important is ensuring that every Michigan resident receives safe, high-quality medical care.
The Michigan healthcare system is on the forefront of improving patient safety, and as a result of this, the citizens of Michigan are much less likely to be harmed when they're admitted to hospitals or intensive care units than they were before.
The conference calls help us all share in the best practices and help us get through the bumps together as a group, which is amazing. I think we've learned a lot from each other.
I would sum it up with the word collaboration.
Collaboration.
Keystone's really critical to the future of healthcare. It's taught us how to improve quality from a collaborative point of view, bringing the hospitals across Michigan together for the same purpose, to improve the quality of care through the use of evidence-based medicine and protocols and improving safety for everybody.
Programs like Keystone are absolutely indispensable, particularly for smaller community hospitals, because we don't have the same kinds of resources that a larger place might have. So it really gives us access to evidence-based medicine, to national, state level, local benchmarking that we wouldn't be able to really acquire on our own. And I think a program like Keystone raises the bar for all of us.
I think we're in a leadership position in this state relative to what other states are doing, and that's due to the leadership that the Hospital Association has taken. I know that others have come to the state to understand what's happening at Keystone, what's happening in Michigan hospitals. I think they're impressed by the fact that nobody's making the hospitals do this. It's self-initiated. I think there are a lot of other states beginning to wonder how that happened without government intervention or without insurance industry leaning on them, or without the business community somehow twisting their arm. I think it's just been an outstanding self-initiated leadership effort.
It has probably been the recognition that I'm viewed now as very accessible by hospital personnel who at one point in time, because of perhaps my title or position, felt that they couldn't approach me about concerns that they had, and recognizing that that will enhance the patient's experience and ultimately their outcome, I'm very happy.
At the onset, it looked very, very simple, and I would not have predicted that the level of energy that was generated across the hospitals would have been as great as it was. But seeing people get really engaged by BSI reduction and VAP reduction, to the extent I remember going to our board and saying to the board, as we were setting our BSI and VAP rates at 0, and the board pressed back and said, I think this is ill-advised, and this was quite a while ago, but I think that's ill-advised. Look at our current data, we don't want to set up an expectation that we can't meet. And I said to the board, as a messenger for those frontline staff, if you tell them that 0 is unattainable, you're taking away from them this incredible drive and energy that they have and their belief that they can do this. Don't send the message that cutting in half is good enough or a reduction by 25% would be laudable. Tell them that you're behind them and that you do expect a 0 BSI and a 0 VAP rate.
To be able to take every hospital in a state and to be able to engender that kind of enthusiasm in all hospitals and get them to work together to improve outcomes at every hospital. I think to have sort of this wide net and be able to capture all these hospitals and have them all excited about the work and improve and to show this improvement has really been what's remarkable to institutions throughout the country to see that.
The change I've seen since Keystone came to our unit is that the newer nurses feel more comfortable participating in rounds, talking with the doctors, the respiratory therapists, and it's making the newer nurses feel like they're part of the group.
And that's part of what Keystone is all about, is empowering people to speak up if they see things that are being done inappropriately or maybe not the best level of care being provided, and to feel free to call people out on that and correct those mistakes.
The ICU nurse or any nurse, I think, has to feel that they are intimately involved with the care of the patient. They have to feel part of it in order for them to own it. What Keystone did was glue the unit together. They glued the management, they glued the state, they glued the best practices, and they glued the staff nurse to take care of the patient the best way possible. I think Keystone has empowered the staff nurse to give the best care possible to every patient, every day, every time.
It was from the MHA and from Dr. Pronovost and Johns Hopkins. It was the right message at the right time by the right messenger.
The staff now have really caught on and are driven by the patient safety and are all about the great care, and they feel empowered that there's this outside source that also gives them the empowerment to just keep pushing forward for great care. And that's what it's all about, is to make sure that the patient is taken care of in the best way possible.
I can't imagine that these programs wouldn't continue to exist. Frankly, I don't think our staff and our physicians would let us go back.
The goal is to provide better patient care, improve outcomes, decrease length of stay, and just make our hospitals safer for our patients.
What we've done through the first 3 projects of Keystone is embed a path that we're going to go down repeatedly. Because what we've seen is when we work together, we produce better results. And there is no turning back from that path.
You feel very proud and very excited that we're making history. And the reason we're making history is that we're saving lives.
It's really allowed me to look back and think of all of the improvements that have happened at our institution, and I can think of all the infections that have been avoided and think about what kind of impact that's had for our patients. It's really been an exciting thing to see and been a great thing to be part of and to look back on.
Right from the beginning, the Keystone Project has made it easy for us to do the right thing. We've had great outcomes. Our VAP rates have dropped. We've not had a bloodstream infection since 2004, right after the Keystone Project got going. So it's been great outcomes and makes it easy for us to do the right things.
Those things that we should be doing for patients every single day.
When I ask for something like chlorhexidine, they say, oh, Keystone ICU? It's okay. We've got the ear of the hospital with it.
Keystone has provided this institution with an opportunity to generate a culture of safety amongst a multitude of different participants.
Well, I think the most important thing about the Keystone Project from my perspective is the power that the team has to influence culture.
The biggest impact this can have on our ICU is to improve communication and build teamwork between ancillary staff, physicians, and nurses to better patient care. That's what we're here for.
The Nursing Garden City Hospital, the biggest change I see here is the doctors and the nurses are communicating more to each other, and I see less incident reports also, less harm to the patient.
Accountability to our patients. Accountability. Teamwork. Standardization.
Would be partnership. A partnership we have with the physicians and the patients and their families.
Organized.
I would sum it up with the word collaboration.
Communication.
Is collaboration.
Innovative.
The word would be work, but that's a good thing because the work is improving patient outcomes and doing what's best for patients. So it's a lot of work, but it's worth it.
I'd say it was outstanding.
Fantastic.
Exciting.
That would be collaboration.
Enthusiasm by all members of the healthcare team.
Enlightening.
As Keystone expands its initiatives within the state and beyond, the World Health Organization is striving to match Michigan, with the countries of Spain and Ireland first in line. Thanks to Keystone Center's success, it's not an overreach to say lives around the world will now be saved. On behalf of the MHA and all our member hospitals, thank you for your dedication to making care safer.
I think the beauty of Keystone is that it's not a one-time deal. It's not a one shot, you've done it, it's over. The Keystone approach to improvement is proven. It will last over time, and we have ample opportunity in healthcare to apply it to multiple different opportunities to improve patient care, patient safety, and lower costs. It is the future.